Recognizes Mr. Griffith of Virginia for 5 minutes for questions.
Good morning. In CMS's recent Notice of Benefit and Payment Parameters rule, CMS finalized a policy that your agency originally estimated would render more than 60,000 plans illegal to be on the ACA exchange. As many as 2.7 million people may either lose their plan or have to scramble to try to find a new plan. You just finished a whole discussion of people getting caught up in the red tape. Madam Administrator, aren't you the red tape? Aren't you all the ones who are saying you can't do this, you can't do that, particularly when it comes to these ACA exchange programs?
I would say that we are working very hard to make sure that people can enroll in coverage and that they have good options.
But you've taken 60,000 plans off the table.
So the provision that I think you're referring to is our requirement around making sure that people understand the difference between their plans. People will have many dozens of choices. What we found in research and what we found from this experience of states.
And that may be true in some areas, but there have been times in my district, a rural district that's economically stressed, where there's only been one plan available. Now that's changed, there's a couple of plans available, but we're not gonna have dozens, and then you've taken 60,000 plans nationwide across the board off the table. And on top of that, we've seen price increases in the ACA plans. It stands to reason, does it not, that when you limit the number of plans, you create an incentive for price increases? Isn't that true?
I would disagree.
Okay, you disagree. I want to come back to that in a minute, where I had originally planned on starting before you talked about getting caught up in red tape, and I'm back here going, but you are the red tape. I wanted to talk about Alzheimer's. We've got a bunch of folks here from the Alzheimer's Association, including a former aide of mine in the Virginia legislature, Josh Myers, who's with us today. If you look around, you'll see a lot of purple behind you. This committee worked hard to change the way the FDA did its work so that we could get medicines that take a long time to show benefit or to have an impact out there on the marketplace, because Alzheimer's is not something that you cure in a day or a week or 2 weeks. You've got to have years of using these medicines, particularly the if I'm saying it right, the amyloid plaque medications. And we changed those rules. We worked hard in this committee, this subcommittee, so that the FDA could approve it. My question to you is then, the FDA's approved it. When did CMS decide or get authority to operate like a scientific regulatory body when that's the FDA's job? And isn't that what you're doing? You've turned yourself into a regulating body, a scientific regulatory body, by denying paying for the Alzheimer's medication that this subcommittee and this committee on a bipartisan basis worked hard to make sure it was available to the patients of Alzheimer's.
Thank you for your question. And as we've all been talking about, Alzheimer's disease is incredibly devastating, both to the individuals who have it and families. Our requirement by law is to do a determination of whether a drug is covered, whether it's reasonable and necessary for the Medicare population. For the drugs that have been that have received accelerated approval.
And the FDA says it's reasonable and necessary. When the physician says it's reasonable and necessary, isn't it true you're just trying to cost shift?
Our decisions are based on our requirements, the ones that we need to follow.
So you say we need to change your laws.
Of course, Congress has the authority
Has that authority.
to change our rules.
I just don't understand why you're going against what our clear wishes were from this committee, this subcommittee, and the Congress of the United States. I have time maybe to go into one other direction. On those plans that you ruled illegal for the ACA, one of those is a company that is a disruptor. It's trying to try a new model where they get rid of a lot of the middlemen and therefore don't have a network. They approve all drugs approved by the FDA. They'll pay for them. It's a novel approach coming out of Ohio. You all ruled if you don't have a network, you can't be on an ACA plan. How does that make any sense?
I would say what CMS focuses on is making sure that we know that if someone is enrolled in a health plan, they will have access to their doctors. And so that is our requirement.
This plan
around-
allows them access to any doctor they want, unlike the other ACA plans. Sounds like to me this is exactly what you ought to be moving forward to approving. I appreciate your time, and I yield back.
Time's expired. Gentleman